As summer 2024 unfolds, we're witnessing a notable surge in COVID-19 cases across the globe. This increase has been particularly striking in recent weeks, catching many off guard. With high-profile cases such as President Joe Biden testing positive in July and at least 40 athletes at the Paris Olympics contracting COVID or other respiratory illnesses, it's clear that the virus remains a significant concern. Dr. Maria van Kerkhove from the World Health Organization has emphasized that COVID-19 is still very much with us. The WHO's Sentinel-based surveillance system, which monitors data from 84 countries, reports a rising trend in positive tests for SARS-CoV-2. This uptick is not limited to Europe. The U.S. is also experiencing a rise in infections, emergency room visits, and COVID-related deaths. The Centers for Disease Control and Prevention, that is CDC, has projected that test positivity rates exceeded 16% for the week ending July 27th. Marking the highest level seen in any summer surge since the pandemic began. Adding to the complexity, the new Omicron subvariant KP.3.1.1 now accounts for a significant portion of infections nationwide. While hospitalizations showed a slight decrease after a period of increase, viral activity remains high according to wastewater data, which reflects the severity of the virus's spread. With the updated COVID vaccine not yet available, many are left wondering how to navigate this challenging period. For those seeking guidance on managing their health during this surge, Dr. Donald Dumford, an infectious disease specialist at Cleveland Clinic Akron General, offers practical advice. He underscores the importance of maintaining good health habits, such as ensuring proper nutrition, getting adequate sleep, and staying hydrated. Dr. Dumford also suggests wearing a well-fitting mask, particularly in high-traffic areas like airports and airplanes, where the risk of exposure is higher due to the proximity to many people. When it comes to recognizing COVID-19 symptoms, it's important to be vigilant. Symptoms can appear anywhere from 2 days to 2 weeks after exposure to the virus. Common symptoms include congestion or a runny nose, cough, diarrhea, fatigue, fever or chills, headache, muscle or body aches, loss of taste or smell, nausea or vomiting, and shortness of breath or difficulty breathing. Given that these symptoms overlap with those of the flu, the common cold, and respiratory syncytial virus, that is RSV, testing remains crucial for distinguishing COVID-19 from other illnesses. Dr. Dumford advises that if you experience any of these symptoms, it's wise to get tested. The CDC lists several emergency warning signs that require immediate medical attention, including persistent pain or pressure in the chest, trouble breathing, new confusion, pale or bluish lips or skin, and an inability to stay awake. Regarding isolation protocols, recent changes have simplified guidelines. The CDC no longer requires a strict 5-day isolation for those who test positive for COVID-19. Instead, isolation depends on the improvement of symptoms. If symptoms have improved for at least 24 hours without fever-reducing medication, individuals can resume normal activities, but should continue to wear a well-fitting mask for 5 additional days to reduce the risk of spreading the virus. For treatment, most people with mild symptoms can manage their condition with over-the-counter medications such as ibuprofen or acetaminophen. However, those at higher risk of severe illness might be prescribed antiviral medications like Paxlovid or Lagevrio, which are most effective when started within 5 to 7 days of symptom onset. For individuals who are moderately or severely immunocompromised, preventive monoclonal antibody treatments may be considered. It's crucial to avoid unapproved treatments and consult healthcare providers for appropriate care. Looking ahead, the CDC recommends getting an updated COVID vaccine this fall, as new vaccines are anticipated to be available. These vaccines will be tailored to address the current variants circulating. The CDC advises everyone aged 6 months and older to get this updated vaccine, regardless of previous vaccination history. For those recently infected with COVID-19, it's recommended to wait 3 months before receiving the vaccine to allow the immune system to recover fully. In summary, while the summer surge in COVID-19 presents challenges, adhering to health recommendations and staying informed can help manage risks. Continue to practice good hygiene, monitor symptoms, and follow public health guidance to protect yourself and those around you. Stay subscribed for more videos.